Good evening. Good evening. My name is Seyram Selassie. I am the Executive Director of the Agency for Substance Abuse Prevention, and welcome to our Opioid Roundtable event. This event will be hosted by one of our employees, Mrs. Aisha Beard. She has been with the Agency for Substance Abuse Prevention for 4 years, and she is also our SPIF RX coordinator, which funding has made this program possible. Please give me a warm virtual round of applause for Mrs. Aisha Beard. Thank you.
Good evening, everyone. So as he stated, my name is Aisha Beard. I'm prevention specialist here at the Agency for Substance Abuse Prevention. I just celebrated my 4-year anniversary with them on February the 21st. So a little bit about the agency. We cover Calhoun and Cleveland County, and we now have actual funding to now cover Talladega County. And we are serving prevention material and promotion materials dealing around alcohol, tobacco, and other drugs. And we just want to say thank you all who are attending the Opioid Roundtable event. We appreciate every last one of you. As you know, this is a very tough time right now with us still going through the COVID-19 pandemic. We also know that the opioid epidemic never changed as well. In 2020, Calhoun County had 20 overdose deaths. And this number is almost doubled compared to 2019 with 11 overdose deaths. So as of now, Calhoun County has 15 overdose deaths counted for 2021 with more pending. Also, opioids were involved in 46,802 overdose deaths in 2018. Nearly 70% of all overdose deaths, according to the CDC. So this is why events like this is important to share information to the community and other organizations who help serve the community. So with further ado, I'm going to go straight into a few things we need to handle before we get started. You are viewing this webinar in format, which means that you can see the presenters, but your video and audio are off. Please use either the chat or question and answers function located on the bottom of your screen to ask questions regarding anything discussed or specific questions for the presenters. Please state which panelist the question is directed to. At the end of the presentation, we will have a discussion where questions received will be answered at that time. Today's session is eligible for 2-point continuing education hours. Bradford Health Services is providing the continuing education contact hours at no charge to you. Please note that you will receive a post-session email that will include a link to materials presented and referenced today, as well as a link to a video recording of today's presentation. After the conclusion of today's presentation, you will also receive an email with a link to an evaluation. The conclusion of today's presentation, you will also receive that link. The survey link will be open for 30 days post-webinar. You must complete the credit hours evaluation in order to receive credit for your participation. Certificates will be sent via email to those who complete the evaluation within 2 weeks. And there will be an additional survey as well provided by ASAP. Finally, if we experience any technical difficulties today, please stand by while we do our best to resolve them. If the webinar gets interrupted in any way, we will get logged back in as quickly as possible. And that information will be in the chat box for the ones who are still joining in. And with further ado, I would like to go into our first speaker, Mr. Taryn Hayden.
All right, good evening to everyone. I'm Taryn Hayden. I am representing Highland Health System located here in Anniston. We're your local mental health, one of the local mental health centers located in Calhoun County and Cleveland County. I am also, he go get it. I'm sorry about that. I'm still at work. Sorry about that. What I do, I'm a mental health officer. I'm also a therapist. I am also the residential group homes we have for individuals with mental illness. I also am a therapist for the mental health court, VA court, And also I do SAFE, which is domestic violence classes. And also I am a DUI instructor. I do that also part-time. So my firsthand dealing with opiates, I guess, is every day. We treat individuals with mental illness, but some of the people we treat are co-occurring, which meaning that they have both a mental illness, but also have some drug issues. I think what we're seeing now with our clients is what do we know to treat first, mental illness or the opiate issues? Because a lot of people are using opiates as the way to cope. And one of the things we educate our clients about, especially on doing the DUI class, we talk about how opiate is something that's prescribed and given to people when you have surgery, when you have any type of injury, or even for a cough or cold. But what happens, people are not always educated about opiates and how dangerous they are. So what we see, you see people giving opiates as a way to cope with the pain from a surgery, but on the MI side of it, when you are down with any type of injury, say like a hip injury. One story that I love to share with people, and a lot of people that know, is the story about Prince. I'm sure everyone knows who Prince is, a great entertainer. But Prince had an opiate use disorder that a lot of people don't know. A couple of years ago, Prince had broke his hip, and with any surgery, you get put on opiates. Well, most doctors are gonna put you on opiates, and they're gonna ask you about your history of other medications you take. And as we do know, a lot of people are not always honest about medications they're taking. And so the doctor would go in and start prescribing you an opiate. That could be anything from Vicodin, it could be Lortabs, it could be even morphine, it could be numerous opiates. But what happened is, when you have an injury like that, where you're disabled, you can't do the things you want to do, depression sets in. And at this time, this is very important, because this is the time that people should seek services dealing with being disabled from a surgery. It has been on medications, which a lot of people fail to do so. I'm not going to put it on medical doctors, because medical doctors are there to treat the medical issue. But I guess as a society, as a world, we fail to talk to people about, hey, if you start having issues of depression or feeling hopeless, you should contact someone to talk to. So basically, you have these people who get depressed, they finally heal up from their surgery, but guess what? When I was taking the opiate, not only did it numb my pain, it also numbed my emotional pain. And a lot of people forget about that, because I've taken opiates before when I had surgery, knee surgery, wherever the case. I just recently got with a virus. Well, I slept. It was some of the best sleep I ever had. But you don't feel anything. So that depression that I was feeling from being disabled, I don't feel it. But now that I'm off the opiate, well, guess what? All that pain and hurt is coming back. So unfortunately, because sometimes, as being a therapist for 22 years, and even to this day, what I see is a lot of people continue to have a stigma about mental illness. They don't want to come and speak to anyone. And I love the commercials they're having, like there's always someone for you to talk to. Well, people don't want to go to the mental health center because they think, well, you're crazy or something is wrong to you. So people don't seek services. And people want to cope. They're going to find ways to cope their own. And as we do know, drugs are just a quick fix. It doesn't solve the issue. And so what do? I turn back to the drugs. I'm telling myself, man, when I was on the opiates and when I was taking the pain medicine, I didn't feel anything. I didn't feel the depression. I didn't even want to talk about what I was going through. I didn't have to deal with it. I could just stay in my bed all day. That's how I was the last couple of days when I had a virus. I slept. I didn't have to deal with anything. Well, when you recover and when you're off the meds, your issues are still there. And that's why as Highland Health, one of the things we do, we advocate for people to come in and seek services. It's free. We have an open door policy. We always have someone on call. But I think that's where we're letting people down. We're not educating people not only about opiates, but also how to address the mental illness side of it once you've been placed on opiates for some type of illness. Now, with the DUI classes that I do on the weekends, we do continue to have people being arrested for possession of controlled drugs. We can range from sometimes, depending on the drug, can be a misdemeanor to a felony. And so they sent through the court referral program where they are followed by a court referral officer and they sent to Highland Health for the educational part. And me and 3 other great instructors that helped me teach the class, we educate individuals not only about drugs, various drugs, especially opiates, but we also talk about change plan, changing certain aspects of their lives that led to them wanting to abuse some type of drug. But opiate is a major issue for us, because we do have New Direction, which is a part of our company that deals with individuals with substance abuse. We have level 1, level 2, level 3, which is treatment. And again, just like our main center located at 331 East 8th Street, we're located off Coleman Road. And I know my boss is going to kill me, but I don't quite know the address to New Direction, but it's on Coleman Road. But also we provide, it's an open door policy for anyone want to come in and get resources or get help with substance abuse. But what we're seeing is we continue to see a high number of opiates use. We recently went to a AOC training last year where we talk about the rise in opiates, and what we're seeing is people are leaving the heroin and going straight to fentanyl. We're finding where people are even using opiates as strong as what they give elephants and animals. And so it's like, it's getting, you close one door, we crack down on something else, and then another door opens where people find a way to abuse drugs. But I think the key to anything is education. I think as a community and as a world, we don't educate people enough about drugs. I think ASAP and the other Radford, everyone's doing a great job, but there's still so many people out there that we need to reach about the resources out there, and so many people get turned away. I'm on call once a week out of the month, and I get phone calls from people who may say someone's OD'd or someone abusing drugs. And a lot of people don't know the resources out there that can help people cope with opiate use. With me working with the Veterans Court and with the mental health court, which is people who've been convicted of a misdemeanor felony, they enter into mental health court in order to get treatment on the MI side. But what we do see with 80% of the people we do treat in VA court and mental health court, I want to say 80, most of them are drug related. And so what we try to do in those programs, we encourage people to get in treatment. We offer services for people in order to get help, but also that felony and that misdemeanor will be dropped. I think I kind of went all over the place, but look at my time. About it for me, but I'm sure they're going to have questions near the end. And that's it.
Thank you, Mr. Hayden. And yes, I don't know if I made that at the beginning of this, questions and answers. If you have any questions, please go ahead and put them in the chat box, And you can put who the question is directed towards as well, so we'll know, and we will have the questions and answers at the end of this event. And just to piggyback off of what Mr. Hayden was saying, as far as like some individuals use substance misuse to cope with things. That is true, and that's why here at ASAP, we have came up with a cope campaign called Choose Other Personal Escapes. And this is definitely for our college students. So we have that going at Talladega College as well as Gaston State Community College. So it's very important that we teach individuals how you can cope in other ways, as far as like working out, yoga, meditating, even painting. So we'll go right into our next speaker, Dr. Mindy McMichael.
Good afternoon. My name is Mindy, and I am a practicing nurse at Northeast Alabama Regional Medical Center, and I have been here for 30 years. I also have practiced mental health nursing for 17 years, and I'm a nurse educator with Ascend Learning. I received my bachelor's and my master's from JSU and my doctorate from University of Tennessee. So today, what I'm going to speak to you about is caring for the smallest victims of the opioid epidemic. But first, before we start, I would like for you to stop and think for just a second. I'm sure that each of you in this room, and I apologize, we're not in a room. You would think by now I would get used to talking to Zoom, but I'm sure that each of us has been affected by somebody who has had an opioid addiction, whether it be a mother, a father, a sibling, a child, and that has affected our lives tremendously. If it hasn't directly affected us, we know someone that it has affected. I have the opportunity to deal with babies that have been affected by the opioid crisis. Opioid abuse crisis that is afflicting our nation has been the forefront and center of the news for several years now. At least one, usually more stories occur every day, and they tell about the devastation of lives and families and livelihood. As a nurse in obstetrics, I see firsthand the impact of the opioid crisis that no news coverage can really do justice to. Addicted babies born to addicted mothers. After delivery, these newborns are dependent on the substance that their mother has been taking. However, since the drug is no longer in their system, the newborn's nervous system becomes overstimulated, causing the newborn to exhibit symptoms of withdrawal. To see the smallest victims of the substance abuse born in a state of drug withdrawal brings home a gravity of the opioid crisis like no one else, or like nothing else that you've seen. And it's a crisis that does not discriminate. Many addicted patients start out with a legal prescription from their provider as the result of an injury or a surgical procedure. Some of them are also on medication-assisted treatment regimens or prescribed medications such as methadone, buprenorphine, or naloxone. Unfortunately, these medications still result in neonatal abstinence withdrawal, which many times our patients come in and they're like, I'm on methadone, and I've been told that my baby's not going to withdraw from that. But unfortunately, we do see withdrawal symptoms from that. According to the Center for Disease Control and Prevention, national opioid use disorder delivery rates at delivery have more than quadrupled since 1999 to 2014. Further, according to the National Institutes of Health, as many as one newborn in every 15 minutes is suffering from an opioid withdrawal. Now, they're only letting me talk for 15 minutes. So during this talk, we have one baby that is being affected by opioid withdrawals. Within our own hospital at Northeast Alabama Regional Medical Center, we typically deliver around 1,700 babies. Last year, however, we delivered 1,929 babies. On any given day, we will have at least one baby, sometimes as many as 6 in our nursery, who are being treated for NAS syndrome, or neonatal abstinence syndrome. However, several more babies are being scored or assessed every 3 hours for NAS each day. In 2015, we recognized that we had a problem here at our facility, and we began touring other facilities and also collecting data. In 2016, May of that year, we started training our staff, and we decided that we needed to train cuddlers to help be volunteers to assist us with what we were about to undergo. In 2016 of July, we had our first baby to receive pharmacological treatment for NAS syndrome. As of 2/27/2022, we have had 2,839 babies that have been screened because of a maternal risk factor. And we'll talk about that in a minute. Approximately 50% of those that have been screened will be treated or will stay here for 5 days to continue to be screened for neonatal withdrawals. Some infants have been transferred to a level 3 facility, and most of those are per parental request. Only 3 to 4 infants that I am aware of have been transferred due to the need of a higher level of care since the program's conception. In 2021, which was last year, 547 infants have been screened for risk factors, with 32 of those babies receiving treatment with medication. The average length of stay for those babies was 28 days. Excuse me 2 seconds. These newborns experience withdrawals which slightly differ from that of an adolescent or an adult. They experience tremors, insomnia, irritability, constant crying, unlike anything that you've ever heard before, potential seizures, poor feeding, excessive step, diarrhea, vomiting, which can be projectile vomiting, and other symptoms. The difference is that these symptoms can occur as early as 24 hours of age. These symptoms typically occur between 24 and 72 hours after birth. It is all dependent on the type of illegal drug or prescribed medication that the mother is on, or if we have polysubstance use, which means we have a mom that's taking more than one medication, which will then culminate into more severe withdrawal symptoms. Also, if we have a client who vapes, smokes, or consumes excessive caffeine, we will see withdrawal symptoms intensify much more rapidly. These babies require a more intensive one-on-one nursing, including specialized care to administer methadone or morphine orally to decrease their withdrawal symptoms. We use morphine at our facility, and then we gradually wean them off the medication once we capture them to control their symptoms. And because of their discomfort is so bad, we can't put them in a bassinet like we put normal babies in a bassinet, because they cry. They have tremors that are nonstop. And so that's when we decided that, hey, we're going to get volunteers. They're going to come in. They're going to be cuddlers. They're going to wrap our babies. They're going to love on our babies. They're going to rock our babies. They're going to help us feed our babies. And that works wonderfully. And then COVID hit. And so pretty much these babies are one-on-one and sometimes 1 to 2. We provide non-pharmacological interventions such as dimming the lights, reducing environmental stimuli. Sometimes we play relaxation music, and we have a designated NAS nursery for those babies. Neonatal abstinence syndrome, which again is referred to as NAS, that name has now been changed to neonatal opioid withdrawal syndrome, which is called NALS. So you're going to hear me use it interchangeably, but I was taught NAS, so that's kind of where I go with that. It occurs when the pregnant client takes heroin, oxycodone, codeine, buprenorphine, and or methadone, or Suboxone, or Subutex. Infants who have NAS are treated with non-pharmacological methods first, which is crucial, and it is the first line treatment. However, pharmacological medications may be indicated if withdrawal symptoms of the infant indicate pharmacological intervention is necessary to minimize and decrease the severity of the symptoms. And one of the first things I ask my parents, because a lot of times they're like, oh, I don't want my baby to go on medications. And I'll ask them, have you ever tried to come off of your Suboxone or your Subutex or your methadone? Tell me how you feel. And after you start talking to them about that, then they realize, hey, you know what? I don't want my baby to go through the same thing that I've gone through. NAS is a complex, highly individualized, and it's based on clinical findings that vary in onset, duration, and severity. No two babies are alike, thus causing a vastly different response to treatment and long-term outcomes for each infant. Clinical findings of NAS are dependent on several factors. One of the first one includes how the infant's body breaks down and clears the substance from their body. The other is the type of drug that the infant's mother consumed during pregnancy. How much of the drug the infant's mom consumed during the pregnancy. The length of the time that the mother used the substance. If the infant was premature or if the infant was a term baby. There is truly no best treatment protocol which has been established for infants. Protocols have been developed by pediatricians, pharmacologists, and neonatologists. Some use conventional morphine, as I previously discussed, on a scheduled dosing, which is what we do here at our facility, while others give morphine on a PRN basis based on a Finnegan scoring tool, which is what we use to score our babies. Additionally, some facilities are using methadone to manage symptoms. Some of the newest research suggests that it is likely that new treatment methods such as buprenorphine in infants may become a first-line treatment, and also each sleep and console scoring system could possibly be utilized instead of the Finnegan scoring system over the next 3 to 5 years. Needless to say, providing for these little ones can be mentally, physically, and emotionally exhausting for nurses, and something for which nursing school doesn't prepare you for. But the fact is, we often are the first and the main point of entry for both moms and babies. And our profession affords us an opportunity to make a significant impact in their lives. According to the Center for Medicaid and Medicare Services, substance use is now the leading cause of maternal death. Statistics will tell us that there are numerous barriers to care for these women, such as education, financial, lack of treatment programs, and many others. From my view, as a practicing nurse and educator, there are 2 barriers that I see most frequently in practice: lack of ongoing education around substance use disorder and stigma. Since 2015, nursing school curriculums have now included substance use disorder and how to recognize it, the current treatments, and other important information. These are crucial components. However, nurses like myself who graduated forever ago, we have to learn it on the job. And I remember the first baby that I ever realized that had NAS syndrome, and I had no idea what it was called. The mom had been prescribed Lortab for being in a major car wreck where she had crushed her pelvis. And this baby had been here for 24 hours. It had lost an excessive amount of weight. It was projectile puking. It was vomiting. It was had profuse diarrhea. It was screaming with a high-pitched shrill like you have never heard before, and it was shaking uncontrollably, sneezing nonstop. When we finished report, I looked at everybody and I said, you know what? I think this baby's in Lortab withdrawals. So I went over to Google, where we all go, and I typed in Lortab withdrawals. Not Lortab withdrawals for babies, but Lortab withdrawals. And the baby had the majority of the symptoms. So I called the provider that was on call and I said, look, we have a baby and this baby, I think it's in Lortab withdrawals. And he's like, Mindy, how do you know that? And I said, I Googled it. And that baby actually was transported and it went to Birmingham and it was treated. And from there, we decided, hey, we want to do something to keep our babies here. So it's important for nurses like myself to have continuing education, but unfortunately, due to staffing shortages, we're not always afforded opportunities to do such things. But in order to truly understand the impact of substance use, it is especially important that we find efficient ways to help our nurses and nurse managers learn how to identify substance use disorder early in the pregnancy and steps to intervene for both the newborn and the mother. Secondly, it's hard not to feel compassionate for a baby who is born addicted. But for many nurses and providers, compassion doesn't exist for the mom. We can be taught to recognize signs and symptoms of addiction, but how can we learn to be empathetic? Any nurse can tell you that the patient knows exactly how they feel the moment that you walk into their room. It is evident from your nonverbal cues, the way you speak to them, and the amount of time that you spend in their room, and that impacts their perception immediately. If a mom feels that you are judging her, she is not going to always be honest with you, and you will not get the information that you need in order to successfully take care of her and her baby. On top of that, we may be asked to keep the baby's drug screenings and treatments from partners and grandparents out of fear for the mother that they won't understand what's happening or what's going on, or that she's not wanting to break up the family unit. Caring for these moms requires a different mindset, one that we don't all naturally have, but at the end of the day, our purpose is to provide the best possible care for our mothers and babies. There's no easy answer to this crisis, particularly when it comes to pregnant moms and babies, but preparing our nurses for the challenges, the emotional as well as the professional. It is a step in the right direction. I challenge you to each ask yourself, are you willing to feel what others are feeling? And as you take care of your patients, remember and say this: I will treat you with dignity and mutual respect. I will commit to advocate for you and for your baby. I am your person. I will show up for you. I am here for you. I will sit with you in silence if that's what you need. I will talk to you. I will always listen to you. And in closing, I just have a little bitty thing just for you to think about. Just pretend, and it starts out as I am a 21-year-old client who is 6 months pregnant with my fourth baby. I have no prenatal care. I'm trying to, and think ... see a doctor for prenatal care, but I can't because I have a drug history. I don't have my other children because of my drug history, which makes me I feel judged every time I go to the doctor, or when I've had my babies in the past, I feel like everyone in the room is judging me. So what else do you think that they might be feeling? And you can just jot that on a piece of paper or think about it. But one last note, and I've often thought of this as I've taken care of my patients. And again, these are the patients that I love to take care of. Somebody once told me, Mindy, a heroin addict doesn't wake up this morning and say, you know what, I think I'm going to become a heroin addict. That's not their plans. So I challenge each of you to be an advocate, to be empathetic, and to try to make a difference in the lives of others. That's all I have.
Thank you, Dr. Michael. That was great. Very touching. I can only imagine what you see on a daily basis. I have some notes I wrote down. You said over 2,000 get screened, and pretty much 2,000 babies, at least 1 to 6 of those are being treated for withdrawals. That's big.
And that is because of a maternal risk factor. And that is since we started this program. Okay, so that's from back in May of 2016 until now. And we're looking for risk factors. If I have a mom that comes in and she has no prenatal care, that would be a risk factor. That would be something for me to start looking to figure out what's going on. And could there potentially be a substance use disorder? It may just be that she doesn't have a means to get here in a transportation. There could be lots of reasons why she's not attending. And we actually have, and I was gonna try to put it up here, and I'm not 100% sure that I can. And it is little, so it may not show. But, and this is a little bit older. This is when we were actually screening for everything. So from 7/26/2015 to 8/26/2016, we had 282 maternal admissions. And I know it's super hard for you to see this, but these numbers go from 1 to 60. And then at the bottom, we have things such as Flexeril, no prenatal care. They have a maternal drug history. That's going to be an automatic screening. We're going to screen mom and baby. Zoloft, so your SSRIs, a lot of times those will mimic withdrawals from opiates. They have very similar withdrawal symptoms. Marijuana would be something that we screen for, Norco, methadone, and then it goes through lots of your others, Suboxone, alcohol, heroin, Celexa, Adderall, Demerol. And again, all medications have different types of withdrawals, but mainly what we're focusing on is the opioid withdrawals. And those babies, their withdrawals typically start about 72 hours unless moms smoke or vape or do excessive amounts of caffeine. And a lot of times with the smokers, it appears that they're having NAS symptoms at 24 hours, but it's really more or less the smoking. And we start scoring them. And once we reach certain scores, then those babies get moved to the NAS nursery and we start medication until we get them captured. And primarily we give morphine. Occasionally we have to give phenobarbital. And then we have a third medication that we've only used a handful of times. But lots of our babies go home and they do well. I mean, our babies do go home and we have been afforded an opportunity to see them and they do well. But they are fussy babies. These are not babies. They're very difficult to console. And if you haven't seen one, I encourage you to Google and go on and look at some hospitals and you will see what a NAS baby actually does go through. And it is very heartbreaking.
All right, that's great information. I hope everybody was able to write that down. I'm pretty sure you're going to have plenty of questions at the end of this event. All right, so we're going to go ahead and go to our next speaker. If you can stop sharing, Dr. Michael.
I am trying. I don't want to share to stop. Gotcha.
All right, there we go. Now, with further ado, I go ahead and introduce Mrs. Nina Vickers.
Well, hello there. Thank you so much for having me. Like Aisha said, my name is Nina, and I am the Executive Director of Trafficking Hope. We are an anti-sex trafficking organization here in Birmingham, Alabama. I have a bachelor's degree in social services, and I'm currently working on a master's. I've been married for 15 years and I have 4 kids. I have a 21-year-old stepdaughter, a 21-year-old son, and boy-girl twins who are teenagers. So that's fun. But as you can hear, I live a really wonderful life today, but it hasn't always been this way. So for tonight's talk, I'm going to talk from the lens of a survivor of sex trafficking and an addict in recovery. So I'm going to share my story. So I was raised by drug addicts. From the time I can remember, my parents used drugs. And I remember being a child and thinking, when I get older, I'm never going to use. Like, I hated it. But by the time I turned 14, all of those things changed. And I started by drinking here and there with friends, and the drinking then became drinking at school at the age of 14. And then I started smoking marijuana. And then by the time I was a freshman and 14 years old, I was doing hard drugs, and I became my parents' drug dealer at 15 years old. By the time I turned 16, my parents were trying to tell me what to do. And I thought, well, if I can use drugs with you, I can do whatever I want. Not the greatest attitude to have, or a good attitude to have, but that's just where I was at. And I moved out at 16. I thought I knew it all and they could no longer tell me what to do. And so then by 17, I was pregnant. I found out I was pregnant when I was 12 weeks along. So you can imagine that me sitting here listening to Mendy's talk was very difficult because I went through some of those things, and my child went through some of the things that Mendy described. But I found out I was pregnant and I was still using drugs. And I had stopped using drugs once I found out I was pregnant, but it was still very difficult. And so anyway, I got pregnant at 17. I had my son at 18. I stopped using drugs for the most part. I dabbled here and there, but I wasn't constantly using until he was about 13 months old. And at 13 months old, by that time I had went back to school. I graduated high school in like homeschooling program. I had a job. I had an apartment, my first apartment. Well, when he was 13 months old, I went back to using drugs, and very quickly I lost everything. I lost my apartment. I lost my job. By then my parents had gotten clean and sober and took my son, rightfully so. And so I was left to live in my car, live at different people's houses. I never really lived on the street. I didn't live like in a park or really on the street, but I definitely couch surfed. And very quickly after I left my apartment, I found myself staying with men and having what's called survivor sex. So there wasn't like an official agreement that, if you stay at my house, you have sex with me, but it was definitely something that was expected. And so that went on for a couple of years. I found myself in and out of abusive relationships. Most of the time, my boyfriends were drug dealers. And at one point, I was 20 years old. I hadn't quite gotten in trouble yet. And I was gang raped in a hotel, and the men tied me up and left me there. And when they left me, I got out of the ties. My hands were very, very tiny. I was very, very tiny from using drugs. And I got out of being tied up and immediately went right back to getting high. And I found myself at a drug dealer's house because that's just what I did. I went from drug dealer to drug dealer. And a few days later, met a man who I had seen at different places. I'd seen him around town, but I didn't really know him very well. He was 11 years older than me, and he, in a matter of words, sold me the dream, but that took some time. He said, you know what, why don't you come with me? I know you don't have anywhere to stay, and you can come stay with me for a while until you get on your feet. And so I went to stay with him, and I stayed with him. He built me up, he told me everything that I needed and wanted to hear. He told me how beautiful I was. He told me I was loved. He bought me jewelry. He bought me clothes. He kept me high. He did all the things that I was yearning for and really wanting to hear as a teenager and as a child that I didn't get from my father. And then as a young adult that really still wanted from my father or someone, to know that someone cared about me, that I was a person, even though my life was a wreck. And so he built me up. And just as quickly as he built me up, he tore me down. He became very violent, very abusive. But one thing that he always did was keep me high. It was about a month or month and a half into at the time I would call a relationship. I called him my boyfriend at that time. And he took me to a party and told me, basically sat in the car and said, this is what you're going to do. You're going to go in here and you're going to do this, and you're going to come out with this money or these drugs. And if you don't, I know where your family lives. I know where your mom is. I know where your son is. And this harm that I've done to you, I will do worse to them. And I said, but I thought you loved me. And he said, but if you love me, you'll go do this. And so he sold me the dream. And so from that point, he trafficked me as an adult, as a young adult. And that continued to happen for about 9 months. I was never on the street, walking the streets. At that time, there was the internet, but I was never on the internet. He just took me to places that he knew, and I was made to do things with men and bring back money or drugs. And that's what I was made to do. I stayed in what I thought was a relationship for those 9 months. I thought that he loved me. Eventually, after about 9 months, I was clear-headed for a moment, and told him that I did not want to be there any longer, that I didn't want this life any longer, that I had a son, that I wanted to go back, home, and home being my parents' house across the state. And he said, get in the car. And when I got in the car, we drove around for about 49 hours. Yes, we stopped to get food. Yes, we stopped to get fuel. And but we drove around for about 49 hours, and he had a gun on his lap, and he said, you're not going anywhere. It wasn't until about 49 hours later where I remember thinking, God, if you're real, God, if you're real, save me. God, save me. God, save me. God, help me. I remember thinking that. And a short while later, we were in the alley in the middle of the night. The car had run out of gas because he refused to stop and get gas because he thought I was going to run, but I was way too scared to run. The police came. And when the police came, I lied for him and said that the drugs that were in the car were mine, the guns that were in the car were mine, and lied and said that he was someone else. So that way he wouldn't go back to prison. But I knew that I was going to jail. So they took me to jail, but they didn't believe me about who he was. And after reading the police report, found out that I looked physically abused. He was beating me in the alley. And so but they took me to jail, took him to jail. And I continued. So they kept him in jail, ran the prints on everything. They didn't believe that everything was mine. They looked at his background, looked at my background, saw that I was physically beaten, and knew that the story was different. So I ended up getting out of jail sometime later. But for a couple of months, I still sent him money. I was still using drugs. I was still in and out of jail myself. It wasn't until a couple of months later, my felony probation officer said, either you go get an assessment and you follow through with the assessment, or you are going to do your suspended sentence, which is 1 year and a day in prison. And so I went to treatment, not thinking I was going to get clean, just thinking I'm going to get her off my back. But I went and really realized that I wanted something different. And so I went to treatment, to an inpatient program, detoxed, got clean, moved into a clean and sober house. And a short time after that, I got a subpoena letter to go testify against him about everything that had happened. By the time the court date rolls around, it was one of the hardest things I'd ever done, was to sit there and testify against a man who said that he loved me, when it was still really hard for me to believe that he didn't love me. That was just the mind frame that I was in, and very afraid to go and testify. When I did go and testify, while I was sitting there, he was mouthing that he was going to kill me when he got out. Not saying it, but mouthing it. And then afterwards, actually his family came looking for me. So it was very, very, very scary. I will say that I say all this to say that I was trafficked, my trafficker many, many times, even when I felt like I didn't want to use or wanted to do something different, would continually feed me drugs, kept me high even when I didn't want to. He would get very, very high himself, to the point to where he couldn't administer the drugs himself, and so would have me do it. But that's all I'll say about my story. It took me a few years to finally get clean, get my life together. I did end up getting clean and sober, staying clean and sober, obviously. And I ended up going back and using alcohol, and then realizing that alcohol, I couldn't even use that. So I am fully clean and sober today. I just celebrated 10 years back the end of 2021 of clean and sober from all drugs and alcohol. And I am a survivor of human trafficking, but I am not the exception when it comes to human trafficking and the correlation between human trafficking and drugs. I know that the details of my story are going to be different than the details of some other survivor, but the way I was coerced and the way I was continually fed drugs is very similar to many, many survivors. I was looking for love in all the wrong places, and what I was looking for, I found, but in a very, very bad way. So once again, thank you so much for having me, and hopefully my story can help someone else.
Ms. Vickers, thank you so much for sharing your story. You'll be amazed at how many people you may have touched, or especially if they have a loved one that's going through similar situations. So again, thank you for having the courage to share such an amazing story. And you have beat your obstacles, you overcame. So I'm proud of you. Next, we will have our United States Attorney of the Northern District, Mrs. Prim Escalona.
Thank you so much. I just want to start by saying that, gosh, Ms. Vickers, that was an amazing story, an amazing testimony, and congratulations on the 10 years. That is such an accomplishment. And I think I probably echo everybody who's listening to say that everyone here is just so proud of what you've done and what you've overcome. And then also I feel like I have to start and also say thank you to everything Mr. Hayden and Dr. McMichael are doing. And Dr. McMichael, I think if you're taking volunteers to cuddle babies, I know that I would love to do it. And I'm sure that there are other folks on here who would also join me in that. I just don't even feel worthy being on this panel with all of you. So thank you for the work that you're doing in your communities. They said, I am Prim Escalona. I'm the United States Attorney for the Northern District of Alabama. We represent 31 counties kind of across the northern top of Alabama and handle federal prosecutions within those counties. But our office does a lot more than prosecutions. I'm going to talk a little bit about that tonight, but we also do a lot with community outreach and with prevention and reentry, and then also with grant funding. And so I'm hoping to hit on a little bit of each of those areas because I think that that's such an important to have a collaborative and kind of comprehensive approach. And if you're like me and you kind of grew up during the war on drugs, that was everything you heard was incarceration and just say no. And I'm not sure that those policies really served anyone very well. And even today, the number of overdose deaths that occur annually in the United States are 10 times the rate they were before we even started the war on drugs. 5 times more Alabamians die from an overdose, a drug overdose in 2021 than in 2001. So we're certainly not going in the right direction. I could talk at length about the prosecution side of the house. That is what our office primarily does. I could tell you all about the prosecutions that our office has made in recent years and the suppliers of the vast amount of drugs that flow into our state. We've prosecuted prison guards that have smuggled drugs into prison. We've broken up pill mills and placed doctors in federal prison. In fact, we just had a jury return a guilty verdict on a pill mill in northern Alabama today. And we've prosecuted out-of-state traffickers of drugs that bring those drugs into Alabama. And I'm proud of the work that our office has done to take drugs and guns out of our communities and to work with our partners, our local and state partners, to make those communities safer. And we're going to continue that work. But a strategy that solely relies on law enforcement and incarceration to end the drug epidemic in the United States and in Alabama just will not accomplish the goal that we all desire. Robust prevention efforts in our community and the persistent, compassionate treatment of people struggling with addiction must balance or even outpace our enforcement efforts. Each year for the past decade, Alabama has led the nation in the number of opioids prescribed per capita. As of 2020, there were 80 opioid prescriptions for every 100 Alabamians. That's nearly twice the national average. As unhealthy and unacceptable of a statistic as that is, it's nearly half of the rate that opioids were prescribed per person a decade ago in Alabama, which topped more than 140 opioid prescriptions per 100 Alabamians. Even if our state's diminished yet nation-leading prescription rate could somehow be distorted as an ebbing tide of drugs supplied into our state, more Alabamians are dying now from overdoses than ever. Over the last 2 years, Alabama's overdose death rate has increased by more than 25%. An approach that seeks to strike at the supply of drugs while being ignorant of the need to diminish the addictive demand for drugs is doomed to be no more successful than the things that we've tried in the past that we know don't work. Today's answer, and it's really our shared response to the rising drug-related death rate in our communities, must be unlike previous approaches. That's why the work of ASAP and the partners in this summit to increase the capacity and the ability of our community to intervene and break the crippling cycle of drug dependency is so vital. Anyone who has ever struggled with the weight of addiction or knows someone who has, and I know I have family members who have struggled with different types of addiction, and I'm sure that that's probably true of everyone that is at this webinar. Anyone who has seen that knows that the road to recovery is rarely ever a straight, unbroken path. And I think Ms. Vicker's testimony is certainly true to that, that there's lots of stops and starts. And our community and our institutions must be persistent in our compassion and redundant in the safeguards we place around those who are struggling with addiction. The Department of Justice, the Alabama Department of Mental Health, and other agencies throughout the state are pouring out help in Alabama in terms of millions of dollars. That goes for life-saving naloxone, training for law enforcement to provide a pathway to treatment instead of jail. And I know that's something that's very important and near to my heart and my office's work, is to see that there are other options. And so we do a lot of training with law enforcement to work on that, and to support the children of moms who are struggling with addiction and the other things that come along with that. We do a lot with domestic abuse and domestic violence and other things that are so tied intrinsically with addiction. And all of these pieces are a more comprehensive solution than what we had before. But ultimately, it's the unceasing compassion evidenced by the partners in this summit that will make the difference in the lives of the people and of our community. I applaud the work that everyone is doing, and I'm so honored to work beside you. We have a great partnership with our state and local law enforcement over in Calhoun County and Claiborne, and I know that will only continue and thrive. And we also are working to make sure that we come alongside our community partners in that part of the state, just to make sure that we're doing everything we can to support your efforts. And so please do not hesitate to let me know how our office can help, how we can lend support, how we can increase hope and compassion and safety in our communities. So thank you so much for having me. I'm happy to answer questions at the end.
All right, thank you so much, Mrs. Prim. Just to let everyone know, this is our second opioid roundtable event that she has agreed to be a panelist. So I want to thank you for scheduling and taking time out of your busy schedule to actually help educate some of the community members. I noticed you said that the leading nation is the opioid prescriptions, and how overdose in Alabama has increased to 25%. As I mentioned earlier about Calhoun County's overdose, in 2020 we had 20, in 2019 we had 11, and right now we're still trying to get the 2021 numbers, but right now we're at 15 overdose deaths. And that's the whole purpose of this opioid roundtable. Like she said, we're not trying to reinvent any type of wheel when we all on the same one with similar goals. So, just reducing substance misuse in our community is the #1 goal. Now we will go into our intermission. At this time, we'll do like a 10-minute break. So if you need to use the bathroom or anything, this is the time. However, we are about to show you 2 of our lovely commercials that we have out. So if you just give me 1 second.
Where there is pain, there is also hope. Opioid overdose can happen within 1 to 3 hours. Narcan takes effect in minutes. It is not a controlled substance and it's available to anyone. Call ASAP today for more information. And remember, overdose does not have to be fatal. The Good Samaritan law protects people from being arrested when they call 911 and stay on the scene. Hope, hold on, pain ends.
All right, so that is from our overdose data to action grant. And here's our ASAP Prevenger commercial.
Man, I'm so bored. What y'all trying to do tonight? Hey, look, that looks good. What I want y'all to do is flip this down.
doing the boozy box. No one does that anymore. I told you to stay away from the kids in this town.
ASAP prevents your mind your own business.
This is my business.
I'm,
It's partnered with 2 other agencies.
I apologize. Let's start that over.
Man, also, boy, what y'all trying to do tonight? Hey, look, that looks boozy.
What up, what up? I want y'all to do a little boozy challenge with me.
Now, I know you guys aren't doing the boozy box. No one does that anymore. I told you to stay away from the kids in this town.
ASAP prevents your mind your own business.
This is my business. Listen, I know boozy bopping may seem fun, but underage drinking can ruin your life. You can always count on me to be there. ASAP.
Once again, the ASAP Preventer saves the day. For more information on underage drinking, visit asapweb.com.
All right, so that just was a few of our commercials we have. I'm looking forward to making more, especially with that ASAP Prevenger. Now, at this time, I will continue. We'll come back at 7:10 from our break.
I'm here, Mike, if you want to try to.
Okay, I'm going to
Grab
do
your
that,
screen.
right? Let's see. Okay,
That's perfect. That's presentation mode for you.
is that it?
That's it.
Okay, let me back up. Very good.
Perfect. You can leave that on the screen till we return from intermission.
Okay, okay, thank you.
You're welcome.
All right. So let's go ahead and get started with our speaker of the night, Mr. Mike Reese.
Good evening, everybody. I feel really inadequate after listening to everyone else. It's an honor for me to be here, and I hope everybody has enjoyed all the presentations so far. And my name is Mike Reese. I work for the Alabama ABC Board, and I 39 years in law enforcement. I retired in 2011, and I came back part-time for the state. And 22 years ago, we started a program called Operation Save Teens that I split my duties doing the drug work and then going out and trying to educate. So what I'm going to do tonight, some of the slides that I show are graphic, and I'm just going to go ahead and apologize to everyone, but this is a very opioid. There's no other way in my mind. You know, we have to get down and dirty with it. And as you know, there's very few families that are not affected by it. So some of the slides, you'll just have to forgive me and move on. But we do a drug program in schools called Operation Save Teens. And that our goal is to reach out to kids. We make it age appropriate, and we go all the way down into the 4th, 5th grade and up to high school and college. And any group that would like for us to come, I'd be glad to come. But getting started, I think everybody that is tuning in tonight knows that we are in a time where all you have to do is look around you and you see that there are people that are suffering. And you see my grandmother always said that you have to look at the eyes, because the eyes are the windows of the soul. And the agony on the faces of these people is it's heartbreaking. And you know, when they look like that on the outside, you can only imagine what's going through inside what they're thinking and the loneliness and despair that they're feeling. So it's very, very hard to look at. It's hard for me to look at. Being a law enforcement officer, I will tell you this. My career started out, I worked narcotics after 5 years of being a patrol officer, and I worked undercover for many, many years. And at the time, I'm ashamed to say there was things that I saw and did. I never broke the law or anything, but my values changed toward people that use drugs through the years. When I first started, pretty much I have to say that people that are on drugs, I consider them to be low-class citizens, you know, and I'm just telling you the truth. It's a hard thing to admit, but through the years, though, I changed. I saw working undercover against a lot of the people, a lot of good people were making bad choices, and they were selling drugs, which is a crime, and we put them in jail. But things changed dramatically in the last 20 years. I remember when the opioid epidemic started here in Calhoun County, a 15-year-old boy from Alexandria High School was he had marijuana in his truck, and we arrested him, and we were talking to him, and he just asked us, well, he said, rather than hassle me, y'all need to do something about the oxys. And we didn't even know what he was talking about. He was talking about Oxycontin. And it didn't take us long to find out we had about 9 overdoses in a couple of months between Calhoun and Etowah County. We lost several young people. We jumped on it. We started educating, and that's when the very first Operation Save Teens program was done. You can look, you know, in the old days, people considered drug addicts to be all grizzled old men. The way I kind of look tonight, you know, it's kind of rough around the edges and all. But what a heroin addict or a fentanyl addict looks like and all, the picture that you see before you, it was heartbreaking a while ago for Dr. McMichael to talk about the babies and all, but all 3 of these young people could have been heroin addicts. Thankfully, only the mom and dad had the problem, and it was a terrible problem for their family, but the baby was born with medical issues. And this family went, they were Trinity, Alabama. They went to Cincinnati and had a life-saving surgery for their daughter. They shot up in the hospital room and they both overdosed. The wife, the mother, she passed away. The dad was arrested. And when you look at these, it's just hard to imagine. You know, you look at that face and it's heartbreaking to me, you know, that anybody could be going through something like this, and we have to educate. I think that's the key. 2016 was a turning point for me. I've been doing Save Teens for about 14, 15 years, and then this man really opened my eyes. He made a famous speech, and I really listened to what he said. He is the Surgeon General, and by the way, he is the Surgeon General again for President Biden. But he opened my eyes, and he probably opened a lot of people. Some of the things that he said in this famous talk was that in America, about 1 in 7 will face addiction. And out of that 1 in 7, only 10% will ever get the help that they really need. And at that time in 2016, he said about 21 million Americans struggle with substance addiction. The number we know is much, much, much higher now. But it was not that as much as this that really opened my eyes when he said genetics account for about half of a person's likelihood of becoming addicted. I really listened to that, and I started looking around. I come from a family of addicted alcoholics, some drug users, and I got to thinking about that, you know, and when I educate kids, you know, we have to start talking about these issues to kids very young, because they need to know that, you know, one of the things we tell them is not every kid is going to be an alcoholic. The way you become an alcoholic is you start drinking. But they need to know that, you know, if they are genetically inclined and all, it's something that they really have to understand, that that's more and more reason to stay away from it. So, but the thing that really to this day changed me was when he said we had to recognize addiction. It's not evidence of a character flaw or a moral failing. It's chronic disease of the brain. We feel sorry for people that's had strokes and that they've got cancer, and we have to show people the compassion that are drug addicts. And I can tell you that's when I really took heed and my heart changed. The way I looked at things as a whole about the drug effort, you heard Ms. Escalona talking about the ways things have to change and all that. And I agree totally that we have to. But in 2016, that same year, for the first time ever in this country, drug deaths topped 50,000. 50,000 people. And if you know anything about the Vietnam War, the 54,000 people died in a whole war, and then for the first time ever, it was 50,000, and then heroin became the leading cause of death in Americans under 50 years old. It was something that we just, you know, we were not prepared for, and I truly believe Purdue Pharma, the drug Oxycontin, it fueled a lot of this. And people in the line of work I'm in or was in, you realize that Oxycontin tablets and opioid tablets, the generic knockoffs and all, had a huge market on the street. And then people found out they could buy heroin much, much cheaper. And you see the statistics of leading cause of death. And for the first time ever, our life expectancy started falling. Never happened before, ever. And then it started falling because of the situation with the opiates. Started combating about that time. The fentanyl started hitting us between the eyes. Places like Birmingham. I heard Mr. Hayden say a while ago, he's talking about the animal tranquilizer, and it was elephant tranquilizer, the carfentanil, and we started seeing deaths in Birmingham, even from that, across the state of Alabama. And, you know, fentanyl, as strong as it is, you know, it's unimaginable that somebody would put something that's 50 times stronger than heroin and they would try to use it. But the pandemic really created a situation where, and everybody knows the statistics, how much higher. You heard Aisha talk about in Calhoun County, you know, from one year to the next, it jumped from 11 to 20. Birmingham in 2016, I think they had 52 opioid overdoses. And right now in Birmingham, a story yesterday in AL.com said more than one a day is 401, I think, died in Birmingham. And that's how big and how fast that it's grown. It was a perfect storm. We had people that could not go to rehab. We had people that could not go to counseling. We had people that were at home, that they had mental problems that go along with depression and all that. It was a perfect storm, and we saw a lot more overdose deaths, and it was really a tragic situation. And our preliminary, you know, we're always a year behind on statistics, but right now they say over 100,000. I heard a number the other day that they say is going to be released. Should be about 111,000 people died. So if you look at 2016 to 2021, in 5 years, overdose deaths doubled in America. And that's somebody's sons and daughters and mothers, fathers, grandparents. I mean, it affects everyone. We're all affected by it. So fentanyl right now is the leading cause of death for Americans 18 to 45 years old. And how did we get here with the fentanyl is everybody knows fentanyl's been around. The different kinds of fentanyl we're talking about, pharmaceutical, people that are into life, they give fentanyl patches, pain patches and all, but the deaths that are being caused on the street right now it's street fentanyl that's manufactured in China, shipped over here, shipped down to Mexico, and then brought in. And you see the cause overdose deaths, 1 trillion a year, every year, and it's going to continue to climb and continue to climb. The answer, this is not, everyone has their own opinions about this. I know we had to have roundtable discussions, and that's exactly what this is, but it's not possessing 13,000 dosages of fentanyl misdemeanor. I think that anybody that would think that would be all right would be, they just know better, are decriminalizing cocaine, fentanyl, meth, and heroin. I'm talking about it from my point of view. I think it would be a mistake. We haven't seen that done out west, and I would hope that it wouldn't. It's almost like now there's such a movement and all to legalize drugs. Or this famous professor at Columbia admits to using it every single day, and and it's hit mainstream. And people say, well, if this guy can do that, then everybody can. And we know. I'm not saying locking everybody up, because I know that's not the answer. It didn't work, and we had to find sensible solutions to it. I think the answer is education. 111,258 a day, one every 5.5 minutes. And who is it? A beautiful girl from Erie, Pennsylvania, that had battled drug addiction, but she had a kind heart. It's a young man from Alabama that loved people, and he loved his dog. He loved homeless people. He had a kind heart, and we lost him on the very same day, a beautiful Sunday. It was beautiful in Erie that day. It was beautiful in Alabama. And it's too late for these young people, but we have to reach out. We have to find a way to pull them in, get them the treatment that they need. Putting them in jail is the people that are true abusers and they're addicts. We have to find a different solution. And I know people on this panel that are working on that. These ASAP is doing a phenomenal job of educating. We have to get the word out. And I think we have to go young. I think it starts in school, and education is going to have to be the driving force. We have to educate, we have to rehabilitate, and we do have to have law enforcement. I mean, it's all a triangle that we all have a part in this, and we all have to come together and talk about it. You think it happens other places in the country. This is a young man from Raglan, Alabama, a high school senior, a leader at his school, a beautiful young man that had a whole bright life ahead of him. He went to a party with friends. He overdosed. His mom, April, was on a Friday night at a ball game, and then when we're not supposed to bury our kids, and her answer was educate. She travels with me. When I call her, I say, please. I don't have to ask her twice. And just like many of the other parents, Steve Murphy and so many more, Julie Letzinger from all over the state, it's amazing how parents that have lost kids are heroic when they want to go. They don't want anybody else to feel what they feel, and it's easy to talk about a burglar. If it happens to your neighbor, it's a bad thing, but it's a really sad story. But when it happens to you, not sad. It's gut wrenching, and to think that somebody had broke into your house, and that's the way drugs is. There's not any families that are not affected anymore. You may not think it, but a cousin or a distant relative may be, but we are losing way, way, way too many kids. We're losing too many middle-aged kids. I say middle-aged kids, 34 years old, 28 years old, that's still a kid to me. I'm 62. My time, I'm old and I'm moving on before long, not hopefully not to death. I hope I'm going to be around a long time, but it's time for young people to step up and take the reins and run with it. I never want to be ineffective. This is a particular case where two brothers died, and they went to a party and they died from opiate pills. Mom found them dead the next morning. On these tablets right here, they call them blue 30s in schools. That's what kids nicknamed them. And this is a couple of years later, happened again. Two brothers died, but difference was these had fentanyl in them. And that is what I want to talk about for just a minute. Where we got here with the fentanyl, it's so much stronger. Y'all know, I don't have to educate anybody at this. You know, it's strong. So why would anybody put fentanyl into something? You heard earlier, there are people that are they're leaving the heroin and going straight to the fentanyl. And we're going to continue to lose young people, not people that use it at 10 years old. This young man picked it up and absorbed through the skin, and he killed him in Miami, Florida. Somebody had thrown it out a window. This is case after case of young people. A month ago in Connecticut, where a 13-year-old seventh grader walked into a school with 40 bags of fentanyl to distribute. He took some in front of two other students. He died 2 days later. The kids that he was with, because they handled it, they were both hospitalized. They searched his house, found 100 more bags. People need to know this is a 13-year-old kid, and we're seeing it all across the country. A young man that was 14 years old, his mom said, I knew he smoked marijuana. I didn't know he used anything any stronger, and he didn't either. Somebody had put the fentanyl into his marijuana, and it killed him. 14. Such a sad state of affairs, you know, and we're seeing all these young kids, and the reason they're dying is because of the pills. A lot of the pills that are being brought in, and they're being sold. Kids are not even aware of what it is they're taking. And just the other day I saw, this is a famous, Laura Berman lost her son, and she sounded the alarm because her son died because somebody laced his Xanax that he bought on Snapchat. This is the emojis that they're using for the drugs. You see the heroin, you see the dragon, and you know, kids are communicating with the phones. We're seeing it in vape cartridges, we're seeing vapes with fentanyl in them all across the country. We're seeing it in candy. Flintstone vitamins that look like Flintstone vitamins had fentanyl in it. And then I'm almost through, but I want to talk about this for a minute because this is a serious, serious problem. Gas station dope. Kratom, we outlawed in 2016. Kratom OPM, Organic Pleasure Management. But to kids that went in the stores, they said it fast, and it was opium. And parents are the last to know. We passed the law, bought it in convenience stores. We outlawed it, and this is the first exit going into Georgia. You can still buy it over there, and they have giant banners advertising it. And then the other thing is, you know, when we see these things, we get rid of Kratom, we think, and then they start pushing Tiana on us. And Tiana the law was passed last year. We got rid of it. and they're always going to dump stuff on this. So the concerns that we have in law enforcement is this. Parents need to get involved with their kids. They need to know where they're at, where they're going. They need to go into convenience stores and see what's going on. It is a opiate. And a lot of people that are in treatment centers are in there because of things that are sold in convenience stores. It takes us a couple of years to pass the laws. This is the day that we outlawed it in a store in Ohatchee, Alabama. Had a flash sale on it because they knew it was outlawed. You could buy it for $5, the whole box for $45, just cash, put it in separate bags. See, these store owners know. This is a store here in Anniston, and this is the stuff. As a parent, I beg you to go into the stores, go up to the point of sale and look at the area right around the cash register. In closing, there's always going to be a substitute. These are things that we outlaw with the Tiana. These are new things that are in the stores, and we hadn't got lab reports back. But I can tell you now, these people that sell this stuff, they sell it to our kids, like the Delta 8 stuff that's out right now. Please, as a parent, step up. We need you to complain. We need you to do something. And last, you see the despair, but there's recovery. Bradford, Ross, people that are doing a magnificent job. You know, it's just, thank God that we live in a time that we do have some success stories, because it would be so bleak. It's too late for them. You know, Taylor Miller was beautiful inside and out. Never ever be replaced. My son, Matt, that died on April the 21st. I beg you all, when we get tired and all, I said a while ago that, you know, it's time for others to step up. It doesn't mean we're quitting. We're never going to quit. We're going to keep pushing because they're worth it. They're worth it. So please join me. And when you get tired, just dig a little deeper and let's push harder, because every one of these lives, you know, they're worth saving. There's somebody's sons and daughters, and they have worth, every single one of them. So God bless you all, and thank you for letting me be a part of this.
Again, Mike Reese, I know I have had several conversations with you, but my condolences still go out to you and your family. Y'all continually are in my prayers. And again, thank you for sharing that wonderful presentation and, you know, informing the community on things they might not have heard of. A few of those drugs I haven't even heard of. So again, thank you for that. So we will go right into our questions and answers. First person up is Dr. Matt Michael. Do babies have long-term issues from being exposed to drugs in the womb?
I'm gonna mute myself, trying to get my camera going, sorry. Yes, research has shown that it does. We do not follow our babies, unfortunately. I do know one of the best speakers that I ever heard talk. She was a pediatrician from Birmingham, and she was looking at the cognitive delays of marijuana and how the marijuana that people are smoking now is nothing like the marijuana that people smoked in the 70s. And that those children, they are suffering significant cognitive delays. Now, some of the foster parents that I know that have children, we're seeing ADHD, we're seeing cognitive issues, we're seeing behavioral issues. Those are things that, you know, that they're reporting seeing. And then again, it's all going to vary. It's going to vary based on what the mom's taken, how long she's taken it, at what stage of the pregnancy she begins, and how long she continues. And one thing I didn't throw out in the beginning is a lot of times people say, well, why don't they just stop when they find out they're pregnant? Unfortunately, if I'm on methadone and I find out I'm pregnant, if I stop taking that medication, which is prescribed, my baby could die in utero. It could withdraw and die. And so therefore I have to have that medication. So, you know, as far as everything that's out there, I don't know. We just see them while we're here, but I do know that babies are experiencing issues, both behaviorally, cognitively. And I'm sure there's somebody else that could probably speak up about that.
Okay, and to follow up on that question, the next one was, are all babies screened at birth?
Okay, so all moms are drug screened, and moms that have positive drug screens, those babies are drug screened. And then any mom that has risk factors, like if I came in and I had no prenatal care, I would be screened, and so would my baby be screened. And we've been doing that now for several years. ACOG and A1 has recommended universal drug screens. Initially, we had a little bit of pushback because doctors, they were afraid, hey, if Mindy's not screening her patients and Sherry, you know, is, then they're not going to go to Sherry. They're just going to come to Mindy. So now they're screened both, and they're screened in the provider's office, and then they're screened on admission to the OB department. And so hopefully, if we catch it in the provider's office, then we can help get them assistance that they may need. Our goal with this whole program was not to be punitive. I know we got to speak to Brian McVeigh, and I'm not sure several others regarding our program.
Okay, thank you so much.
You're welcome.
Our next question is for Mr. Hayden. And it is, when you do the DUI classes at New Directions, what do you do differently when you have a participant that has been in the program before?
Well, we kind of sometimes use them as an example because we always tell people we provide you with the education. But with the years that I've been doing DUI classes, we do see people come back. You know, they have a change plan, they set up a change plan, and they do well, but we do see a lot of people who come back because sometimes they don't take it serious, or sometimes they're thinking, I won't get caught next time. So we make sure we put a lot of emphasis on that one participant and try to address with them where did we go wrong with our change plan, so we can prevent so many people coming back through the classes. Because if you do continue to come back, you are sent to level 3, which is treatment.
Okay, thank you so much, Mr. Hayden. Our next question is for Ms. Nina Vickers. How often do sex traffic victims return to their abuser after they have escaped? And could you provide an example?
Yeah, so it's very, I mean, there are different statistics out there, anywhere from 7 to 12 times attempting to leave, that they go back and then eventually leave the life for good. But a lot of times, due to drug addiction or homicide, I mean, obviously people also lose their lives. But I can tell you that I tried to get out 3 times. It was my 4th time that I finally left for good. But definitely on average, I've read anything from 7 to 12. So it really just depends on which research you're reading, but it definitely takes a lot of times more than once.
Thank you so much for that information. Next question is for our United States Attorney, Mrs. Prim Escalona. How does or what process is used by the DEA or your federal DA office track opioids from both individuals in typical pain clinics? What indicators do you look for to find illegal abuse from a medical practitioner?
Thanks. So I'm probably not going to be able to speak too much to the details of that because we try to keep our methods and in our investigations pretty close to the vest, because for obvious reasons, if we told everybody what we were looking for, then that would just give those individuals who are looking to skirt the law a head start on us. And so we don't really disclose exactly what those investigations look for and what they do, but I will tell you that we just kind of look at a variety of factors. And a lot of times it's what is typical in the community and what the doctor's area of specialty is. And that can kind of lead down a road. We work with other U.S. attorneys' offices, and DEA works kind of in a regional footprint so that we can see trends that are happening in other places and see how that informs what we do here.
All right, thank you for that. So next, I will have one of our FBSS ambassadors. He will introduce himself.
Sorry. Good evening to each of you. My name is Byron Jackson. I am a member of the team here at ASAP. I was brought on as the FBSS ambassador, and I want to tell you about this new and innovative program that ASAP has birthed. The FBSS program stands for Faith-Based Support Specialist. It stands for Faith-Based Support Specialist. This program was birthed by the agency after noticing that most people who are struggling with substance use disorder actually turn to their church or faith community first. And so what we've done is created a program that will equip pastors with the ability to minister effectively to those struggling with substance use disorder. And so we're going to pull up this quick presentation, and I'll tell you more about this program in just a second.
Okay.
All right, so as I stated, this is the FBSS program by the Agency for Substance Abuse Prevention. It is a brainchild, of the ASAP team and the agency here. That is a photo of the team. But I do want to start by saying that this program is an ecumenical program. So it is not just a program for one denomination or faith, but it is a program that is meant to touch all faiths. And you can see there on the screen just some of the faiths that we seek to reach, touch, and also equip. This actual program is designed for senior level religious leaders, okay? And so whenever I present this program to a group of pastors or an individual pastor or religious leader of any particular faith or denomination, I start by asking them some questions about their ministry. Do you believe, or do they believe, that their ministry is equipped to handle substance misuse matters? Because the truth is this: I myself am a local pastor. I pastor a church here in Anniston, Alabama. And the reality for me myself was this: that I have had in my 8 years of pastoring, members of my church, also people in our community, to come to me and inform me that they were struggling with an addiction of some sort to some substance. And so I've prayed with them, I've counseled them, but the reality is that after that, I had no practical help to offer them. And that's where the FBSS program steps in, is that we believe as people of faith that prayer and that God is the answer and can heal and can deliver and will do that, while at the same time believing that there are practical outworkings to the answers to our prayers. Just as a general rule, whether people actually believe or not, and I've experienced this in my ministry as well, people actually turn to the church in time of crisis, whether that's for a practical matter like not having enough money to pay their bills, or even reaching a place of desperation and depression. People turn to the church in time of crisis. And so we've got to ask ourselves some questions. What do churches do with people who are dealing with these issues? And also, where do we send them? Okay. And so This program has been created to sort of fill this void and bridge the gap between the mental health field and the faith-based community. We actually believe that prayer, prevention, and treatment do indeed work and go together. Identifying this gap between the two, between the mental health field as well as the faith-based community, we brought in this program with the purpose of connecting the church, senior level religious leaders, whether that be a pastor, a youth pastor, somebody who's leading small groups, but these are ordained ministers, leading these people and connecting them to the resources that are available, not only locally, but also statewide. This program has received statewide funding from the FOR Foundation. That's the Foundation for Opioid Response Efforts. They granted ASAP funding to train 240 pastors statewide. So that this year and next year, our goal is to train 120 pastors and faith-based leaders throughout the state of Alabama this year and next year. So the faith-based support specialist program, how does it work? That's the question that everybody wants to know. I've already told you it's an ecumenical program. It's free as well. It costs participants nothing because the funding that we receive from the FOR Foundation actually covers the cost for this certification. It is a certification that is backed by the Alabama Department of Mental Health. So here's how it works. It is my job and my duty, along with the team here at ASAP, to recruit pastors and senior level religious leaders to come to a 2-day conference. It's 16 hours over the course of 2 days to become a faith-based support specialist and receive this certification. Now, it's not just one conference. We're going to host 4 a year. So we're starting here in Oxford on March 31st and April 1st of this year. So at the end of this month, we'll actually host the first FBSS training conference. It covers the I-20 corridor across the state of Alabama. It covers Cleburne and Randolph counties on the east side of the state, all the way over to Tuscaloosa and Pickens on the west side. So March 31st and April 1st, all trainings take place on a Thursday and Friday. We will meet right here in Oxford, Alabama at the Oxford Civic Center for those who have registered. Our goal, based on the numbers laid out, is to have 30 participants per region. But the response to this program has been so great that we're already at 40 participants for the very first FBSS training conference. So that's going to take place at the end of this month. The next one will take place June 23rd and 24th in Huntsville, Alabama. The next one, the next quarter, will take place September 23rd and 24th in Montgomery, and we'll close out the year December 8th and 9th in Mobile. And so the purpose of this conference is to bring all of these senior level religious leaders together, and we want to give them the most up-to-date information. So we have representatives and facilitators and presenters and speakers from only certified resources, from certified agencies and treatment centers from across the state of Alabama, who are going to be presenting in order to help and educate these pastors as they work toward certification. After those 2 days are done, those participants are certified. One thing that is required, though, is 8 hours of continuing education over the next 2 years so that one can maintain their certification, okay? As you can see here on the screen, there will be many training topics covered. I won't get into all of those, but I do want to quickly hit on a couple of them. We want to definitely give pastors communication skills. And I know that sounds crazy because we stand up and we present sermons and preach to people and teach people on a weekly basis. But sometimes we live in a bubble, right? Because we go to church, we deal with our city leaders and our congregations, and then we go home to our families. But we need the specific capabilities to deal with people who are on substances, because oftentimes you aren't necessarily speaking to them in those situations, but better yet, actually, you're still speaking to the actual substance. And so we want to be able to give them the ability to listen effectively and know how to communicate with those who are dealing with this disorder. Also, we need cultural competence. We need to know, I guess I'm going to tie cultural competence and emerging trends in substance misuse together, because pastors need to know that the idea from 20 years ago of what the drug dealer looked like is no longer the same. Now, addictive substances are sold legally at stores and convenience stores, and people are able to get their hands on them easily, of course, and that's not even to mention alcohol, right? And lastly, we want to put all of the resources, certified resources statewide at the fingertips of these pastors and faith-based leaders. And so after one completes the 16 hours, becomes a certified FBSS, faith-based support specialist, they will have credentials to enter into a database where they will have the resources so that when they do communicate with somebody or counsel somebody, they don't just pray for them or provide spiritual counsel, but they can also go into this database, and with their education, with their certification, they will be equipped to refer them to the right place and right treatment facility that can deal with their specific situation. And so it's a great program that is meant to help aid pastors in changing the outcomes that substances cause in our communities, okay? As I close, the role of these FBSSs is simply this: that, of course, you have to do your continuing education, but you also need to encourage other faith-based leaders to get their faith-based support specialist certification. It's important that we don't hold this up for ourselves, but that we spread the word in order that other faith-based leaders can become equipped so that we can close this gap. There is a stigma in the church. No matter what faith you're in, no matter what denomination you're a part of, there is a stigma in the faith-based community concerning mental health and mental illness. And we want to bridge that gap as best as possible. And these faith-based support specialists will have the ability to provide certified, and that's why it's in bold there. We want to provide certified resources to people who are in need of them. And then we want to report data so that we can prove the validity of this program. We want to gather as much data as possible in order that we can show and prove that this program is actually making a difference in the lives of our communities, okay? Listen, if you have any questions, you can type those in the question and answer section, and hopefully we can reach out to you and answer them. And so, oh yeah, and if you have any questions, you can also email me directly. My email it's already in the chat. Thank you so much. My email is in the chat, but it's byronajackson@gmail.com. Thank you so much for listening in and tuning in, and also joining us for the ORT tonight. Thank you.
All right, thank you, Byron. Okay, so we're gonna go right into the announcements. If any of the opioid roundtable committee, if you have any announcements, just please put them in the chat box since we are, getting close to time. So we have our Take Back on April the 23rd. This is the National Prescription Drug Take Back Day. We will be at the Jacksonville Walgreens. We'll be at the Walgreens in Anniston, Wright's Pharmacy in Cleburne, and we're hoping, Oxford CVS, and we're actually working on having one at the Talladega College on the same day as well. That would be from 10 to 2. I want to thank Ross, which is the Recovery Organization Support Specialist, for providing us with the TV, which is our prize giveaway. So once you come to one of those locations and you drop off any unused or expired medication, you will be able to get a ticket. And then following Monday, we will be pulling for the winner of that big, I think it's a 50-inch TV. So yes, please come out. That's April the 23rd. We'll be at those locations from 10 to 2. You can check our website at asaprev.com for further information on those locations. Next, we have our scholarships. We do scholarships for Calhoun and Cleveland County City Schools. That due date is April the 8th. And this is for, we're offering 5 $500 scholarships. and you have to be attending an institution of higher learning. If you're looking for the application, again, that is also on our website, and you can get that at asaprev.com, which is asaprev.com. I mentioned this at the beginning that we will have a survey that's going out, and one of our ORT members will be providing you with that survey. It will be emailed to all of you to help ASAP, seek new ways on how to make the next opioid roundtable better. All right, and at this time, that concludes all of my announcements. I'm bringing up my Executive Director, Sayron Selassie.
All right, good evening, guys. Once again, I am Sayron Selassie, the Executive Director of the Agency for Substance Abuse Prevention. If we could just all you guys give some type of wave hand or whatever, let's give Aisha Beard a big virtual round of applause. It was her first one managing this meeting. She did a wonderful job. So I want to go through some more thank yous. So again, thank you again to Mrs. Aisha Beard for all of her hard work on putting this program together. I want to thank the panelists, Dr. McMichael. I want to thank Mike Reese. I want to thank Mr. Hayden. I want to thank definitely U.S. Attorney Prem Escalona and all your hard work and everything that you've done with us working together. We want to thank our Opioid Roundtable Committee. Many of you guys don't know, but we don't just do this ourselves as ASAP. We believe in the phrase of not working in silos. So the Opioid Roundtable is pretty much a local coalition of different groups from prevention, treatment, rehabilitation, counseling. We all come together to figure out how and what may be the best ways to address the opioid epidemic in our own community. So we would encourage all 200 some odd of you guys out there, even in your own communities. Your community looks a little different from a Calhoun County / Cleveland County, Alabama. So in your own community, form those coalitions. There are many people that are doing the good work, but we can't operate in silos. So when we break down those silos, we're able to more effectively work together to address these issues. The next person, our group that I want to thank is ADMH, the Alabama Department of Mental Health. This program would not have been possible without their funding. ASAP was awarded the SPIF-RX grant. That's what has funded this program. That stands for the Strategic Prevention Framework to Reduce Prescription Drug Abuse. And we'll go ahead and tell you guys, some of you all are the first to know, we were just awarded the SPIF 2.0 grant. That's the big brother, or if I can use that term, of the SPIF 1.0. So we just were awarded that grant. So you guys will be hearing a lot more about what we'll be doing with that particular funding. So again, thanks to the Alabama Department of Mental Health and the Prevention Director, Ms. Beverly Johnson. So with that, we have thoroughly enjoyed you guys this evening. We hope you learned something. Please remember about the CEUs. Please remember ASAP will be sending out a survey as well. And we just want to make sure that you guys continue to get the most up-to-date information that you all need to make our community safer. So with that being said, we're going to wrap it up. And thank you guys again. Everyone have a wonderful evening. Goodbye.